right, good morning, everyone. My name is Liz Wiens, and I'm one of the community health nurses here at Two Rivers Public Health Department. I'll be presenting our February clinical call to you this morning. My hope is this information will be helpful to both you and your clients. So some of the topics we'll be discussing today include our new VFA program, heart disease and its risk factors, food recalls, respiratory illness, the NICE book, radon, lead and water, our family support program, and some of the TRPHD website highlights. The Two Rivers Public Health Department serves almost 100,000 individuals in 7 counties that cover approximately 4,624 square miles. These counties include Buffalo, Dawson, Phelps, Kearney, Harlan, Franklin, and Gosper. Both our mission and vision statements are included here, which encompass our ultimate goal, healthier communities for all. And here is a slide that contains our TRPHD nursing team. Our nursing team includes 5 community health nurses, 2 program nurses, and 1 billing specialist. We continue to promote our new Vaccines for Adults, or VFA program at Two Rivers Public Health Department. This program is specifically for individuals who are uninsured, meaning they have no insurance, or underinsured, meaning their insurance doesn't cover vaccinations. We encourage all clients to call our office to schedule an appointment and to ensure we have the specific vaccine or vaccines that they are interested in on hand. February is Heart Month, and heart disease is a leading cause of death for men, women, and people of most racial and ethnic groups in the United States. The statistics are staggering. 1 person dies every 33 seconds in the United States from cardiovascular disease. About 695,000 people in the United States died from heart disease in 2021. That equates to about 1 in every 5 deaths. Heart disease costs the United States about $239.9 billion each year. Those stats are from 2018 to 2019. This includes the cost of healthcare services, medicines, and lost productivity due to death. Looking at the map of the United States, you can see how Nebraska compares to the rest of the United States. Teaching those we serve about the risk factors for heart disease that we can and cannot control is key to keeping Nebraskans' heart disease risk low. And I included a QR code there for more information from the American Heart Association. And so as I mentioned, both non-modifiable and modifiable risk factors are important to understand. Non-modifiable risk factors for heart disease include age, gender, and heredity. The majority of people who die of coronary heart disease are 65 or older. While heart attacks can strike people of both sexes and old age, women are at greater risk of dying. Men have a greater risk of heart attack than women do, and men have attacks earlier in life. Even after women reach menopause, when women's death rate from heart disease actually increases, women's risk for heart attack is less than that for men. Heredity also plays a role. Children of parents with heart disease are more likely to develop heart disease. Black people have disproportionately higher rates of more severe high blood pressure, which is a modifiable risk factor we'll talk about here in a moment, and it develops earlier in life. Heart disease risk is also higher among Mexican, American Indian, Native Hawaiian, and some Asian American people. This may be partly due to higher rates of obesity and diabetes, which are also some of those modifiable risk factors. So first on the list for modifiable risk factors is tobacco and vaping. Tobacco use is a major risk factor for heart disease and stroke. Nicotine is one of the chemicals in cigarettes and e-cigarettes causes your heart to beat faster and blood pressure to rise. Smoking makes clots more likely to form. It can also promote the buildup of plaque in arteries. Exposure to other people's smoke also increases the risk of heart disease, even for non-smokers. Cholesterol circulates in the blood. As the amount of cholesterol in your blood increases, so does the risk to your health. High cholesterol contributes to a higher risk of cardiovascular diseases such as heart disease and stroke. Most people's goal for total cholesterol is less than 200. In terms of blood pressure, high blood pressure increases the heart's workload, causing the heart muscle to thicken and become stiffer. This stiffening of the heart muscle is not normal and causes the heart to function abnormally. It also increases your risk of stroke, heart attack, kidney failure, and congestive heart failure. The goal for blood pressure is less than 120/80. Inactivity plays a role as a modifiable risk factor. An inactive lifestyle is a risk factor for coronary heart disease. Regular, moderate to vigorous physical activities can reduce the risk of cardiovascular disease. Physical activity can help control blood cholesterol, diabetes, and obesity. It can also help lower blood pressure in some people. Adults should aim for at least 150 minutes of moderate to intense physical activity a week, or 75 minutes of vigorous intensity physical activity, or a combination of the two. People who have excess body fat, especially if a lot of it is at the waist, are more likely to develop heart disease and stroke, even if they have no other risk factors. Overweight and obese adults with risk factors for cardiovascular disease, such as high blood pressure, high cholesterol, or high blood sugar, can make lifestyle changes to lose weight and reduce risk factors such as high triglycerides, blood glucose, hemoglobin A1C, and type 2 diabetes. Diabetes seriously increases your risk of developing cardiovascular disease. Even when glucose levels are under control, diabetes increases the risk of heart disease and stroke. The risks are even greater if blood sugar is not controlled. Everyone feels stress, but people react differently. Individual responses to stress may be a contributing factor for heart attacks. Over time, you may become prone to unhealthy responses to stress that may create health problems. For example, if you are under stress, it may cause you to overeat. You might smoke to try to relax yourself. And these are things, obviously, that you wouldn't do if you weren't as stressed, potentially. Sleep, getting a good night's sleep regularly is vital to cardiovascular health. Good sleep benefits your whole body, including your heart and brain, and can improve mood, memory, and reasoning. Adults should aim for an average of 7 to 9 hours a night, and babies and kids need more depending on their age. Drinking too much alcohol can raise blood pressure and increase your risk for cardiomyopathy, stroke, cancer, and other diseases. It can also contribute to high triglycerides and cause irregular heartbeats. Excessive alcohol consumption also contributes to obesity, alcoholism, suicide, and accidents. And finally, diet. A healthy diet is one of the best ways to fight cardiovascular disease. What you eat and how much of it can affect other controllable risk factors such as cholesterol, blood pressure, diabetes, and weight. Choosing a nutrient-rich foods which have vitamins, minerals, fiber, and other nutrients, but are lower in calories than nutrient-poor foods. Choose a diet that emphasizes vegetables, fruits, and whole grains. A heart-healthy diet also includes low-fat dairy products, poultry, fish, legumes, nuts, and non-tropical vegetable oils. Be sure to limit your intake of saturated and trans fats, sodium, sweets, sugar-sweetened beverages, and red meats. At Two Rivers Public Health Department, we are exploring expanding our health screenings to the community. We currently have the capability to check blood pressure, weight, body mass index, cholesterol, and hemoglobin A1C. Please reach out to us if that's something that you may be interested in. All right, this slide is meant to bring attention to the number of food recalls that occur each month. The USDA is primarily responsible for supporting agriculture in the United States and is in ensuring the safety of agricultural products. The agency's oversight includes meat products like beef, pork, lamb, and poultry, processed egg products like powdered or liquid egg products, dairy products, fruits and vegetables, and other products containing greater than or equal to 2% cooked meat, poultry, or greater than or equal to 3% raw meat, poultry, and poultry, as well as catfish. The USDA makes sure that the nation's commercial supply of these products is correctly labeled and packaged using a pre-market approval design. Further, the Food Safety Inspection Service, an agency within the USDA, issues policy guidance, nutrition labeling, and memoranda regarding the mentioned food products. Looking at the FDA ensures that food sold in the United States is wholesome and safe using post-market surveillance. Additionally, the agency monitors foods, drugs, dietary supplements, and animal feeds. The FDA requires proper labeling of most prepared foods like cereals, bread, canned and frozen foods, drinks, desserts, and others. On the other hand, nutrition labeling in raw produce or conventional foods is voluntary. The FDA's food labeling guide answers most of the questions that food producers might raise. The FDA regulates most of the U.S. food supply, like meat, which would include the non-specified red meat and game animals, shell eggs, like whole eggs that are still in the shell, processed produce like fruits and vegetables, some products containing less than or equal to 2% cooked meat and poultry, or less than or equal to 3% raw meat or poultry, seafood except catfish, infant formula, and dietary supplements. The FDA regulates more than 80% of the U.S. food supply, including dairy, seafood, processed and packaged food, and even bottled water. Many Americans think the USDA is the primary inspection agency for food inspection, as the blue stamps on a food feature the USDA logo prominently. In contrast, the FDA logo doesn't appear on the nutrition label of foods or supplements they approve. Both of these websites included on the slide are very good at describing the recall and what part of the US or world these items were shipped. This is something to keep in mind when considering foodborne illnesses in those we serve. Just Friday, the FCIS within the USDA issued a public health alert for ready-to-eat poultry products produced by Rizzo Lopez Foods containing FDA-regulated dairy products. They were recalled due to possible Listeria contamination. Trader Joe's and Amazon Kitchen both carry this brand, so this alert has nationwide relevance. Thankfully, there have been no confirmed adverse reactions related to the consumption of the products. All right, we'll move on our discussion to respiratory illnesses, starting with COVID-19 hospitalizations. CDC data through February 3rd reports COVID-19 hospital admissions at 20,772, which is down 10% from the previous week. This equates to about 6.26 hospital admissions per 100,000. As you can see, our jurisdiction's COVID levels are considered low, which is great news. Other respiratory viruses continue to plague Nebraskans. This map, which was updated on Friday, includes influenza data up to February 3rd. As you can see, Nebraska is in the high zone. The 2 weeks prior to this, Nebraska flu levels were considered moderate. You can see last week's map in the little window at the bottom right. This is not the first time we have seen this high level of flu activity this season. We last saw it the first week of 2024. And this is specific data to our jurisdiction. You can see how influenza and RSV have been trending in our district. Our positivity rate is higher for all three than the state's overall positivity rate, as you can see in the next slide.
Look at that.
And this slide contains how things average out throughout the entire state of Nebraska. All right, speaking of illnesses, the NICE book is a collaborative development between Children's Nebraska, Nebraska chapter of the American Academy of Pediatrics, Nebraska Department of Health and Human Services, Infection Control and Prevention, or ICAP of Nebraska, Nebraska Department of Education, the Nebraska Extension Office. The NICE book helps make creating and maintaining school environment to reduce the risk of disease transmission possible. It covers a wide range of topics, including prevention, outbreaks, immunizations, infectious diseases and pests, bloodborne pathogens, and other resources. It also includes sample parent letters and many educational handouts in English and Spanish that may be photocopied and distributed without restriction. And you can access this book. It's an online book from this QR code or the website link that's provided here on this slide. So you can't see, smell, or taste radon, but it could be present in your home. Radon is the leading cause of lung cancer deaths among non-smokers in America and claims the lives of about 21,000 Americans each year. The EPA and the US Surgeon General urge all Americans to protect their health by testing their homes, schools, and other buildings for radon. The US Environmental Protection Agency recommends fixing your home if radon levels are above 4 picocuries per liter of air. TRPHC still has more than 100 free home radon kits available for the public. Please communicate this information to those who you think may benefit. All right, many of you may know that I am the lead lead nurse at Two Rivers Public Health Department, so this topic is very near and dear to my heart. We all know that lead is a health hazard. Infants and children are particularly susceptible to the health effects of lead. Drinking water with more than 15 parts per billion, or ppb, of lead over long periods of time can cause health effects such as delay in children's physical or mental development, decreased IQ in children, kidney problems, high blood pressure, and increased risk of cancer. The good news is that in Nebraska has regulations governing public water supply systems that are set by the Environmental Protection Agency, and these regulations require cities in our jurisdiction to consistently test their water. In instances where the lead level exceeds 15 parts per billion, the city notifies the residents and reports back to the EPA with actions taken. As a provider, here's some information you might find helpful if you have a client who is affected by lead in their water. This will also be the focus of my monthly education. So if your lead levels are above 15 parts per billion, use water from a safe source to drink, wash, prepare, and cook food. And that you can get that water from that safe source by either using bottled water or using a certified point of use filter on your water spigot, or in an actual filter, like say you think of like a Brita filter or Brita pitcher. You can add those certified point of use filters to those as well to filter that lead out of the water. It is safe to use water that contains lead for showering and bathing because very little, if any, lead is absorbed through skin. Water with lead above 15 parts per billion can be safely used to wash and sanitize dishes, tables, and eating utensils. Water with lead above 15 parts per billion can safely be used for general cleaning and washing of clothing, bedding, and linens. Just like humans, animals should not drink water with lead levels above 15 parts per billion. So you would either want to have that special filter on your water to filter out your water, or use bottled water for them as well. Irrigation with lead contaminated water does not significantly increase soil lead levels. So that's good news for those people that garden or are just watering their grass outdoors. It's safe for your pets and for you to grow those gardens, even if your water does have that lead in it when it comes to irrigating. And then Nebraska DHHS encourages parents and patients to request that their provider order a blood lead level test anytime they feel it is warranted. So anytime, if this is something that happens with one of your clients, just remember that a venous lead level draw will give the most definitive picture of an individual's lead level. If they reside in a community that has reported elevated lead levels in their water, as a provider, you may consider starting with a venous draw right away, just so you can get that big picture of where their lead level may be. And another new program that we have here at Two Rivers Public Health Department is the Family Support Program. And the Family Support Program's focus is to enhance child welfare, promote child well-being and development, and prevent child abuse and neglect through family-focused support provided in the comfort of a family's home. The program takes referrals from pregnancy until a child is 3 months of age, and then the program can follow the family until the child is 5. The Family Support Program is working hard to make an impact in all areas of our jurisdiction and are looking to increase their outreach and services in the areas of Harlan and Franklin County. Please contact Haley Eshelman for more information on this program. The next 2 slides provide some Two Rivers Public Health Department website information. The Zoom link to our monthly clinical call is posted on our website. So please spread the word. We would love to reach more people with it. Here is our February community event calendar. Please note that the day and location of our Lexington Mobile Vaccination Clinic has changed. It will now be the first Wednesday of every month, beginning at 3 p.m. at the Dawson County Annex Building in the training room. And so this concludes the February clinical call. Are there any questions? All right, thank you all for your attention. Have a great day.